Hey, I'm Shane from Chainson Law. I'm here today with John, one of the associate attorneys here at Chainson Law. We're going to talk about one of his recent client victories. These are cases where we got a great result for the client. We just want to talk a little bit more about how the action occurred, what the treatment was, and what happened overall in the case. So John, tell us about AO's case.
So in this case, a client came to us after he was involved in a very, very serious motor vehicle collision, T-bone accident, over 55 miles per hour. So injuries were immediate, severe, property damage, severe. AO needed help.
Usually there's a lot of damage. And unfortunately, a lot of times the impact comes from the side. So it's just easier to damage your neck is what I'll say than it will if you're just rear-ended or hit right from behind. So what were AO's injuries at the scene?
Primarily the injuries were to the spine and the back. In this case, it was the lower back that presented the majority of the injuries that AO suffered. And that's what AO spent the majority of the case treating.
How was liability-wise? Did the insurance company accept it right away, or did they fight about any of it? Because sometimes we see them fight on these kind of cases.
Luckily on this case, the insurance company, when presented with all of our evidence, documentation, a good police report, they did not fight us on liability. They certainly love to fight liability on these type cases, but luckily the documentation was there where they realized that was not a hill they were gonna be wanting to die on.
Prepared to die on, huh? So it was pretty solid and tight at the beginning. AO got the treatment for the lower back. So what was AO's treatment path? What happened?
Our client started at the chiropractor. Chiropractors do a great job of initially assessing the injuries, strengthening the injured areas, and kind of seeing if it's gonna be a soft tissue injury case or if it's gonna require more additional treatment from potentially an expert. In this case, AO's pain did not resolve, which means he didn't get back to normal and he didn't get his pre-accident pain where it needed to be. So he had to go and see an expert, in this case, an orthopedic.
And normally, if they're going to get better with the chiropractor, we expect that to happen somewhere between about 8 weeks and 12 weeks. And AO's pain levels just weren't dropping at all.
Absolutely, and that's exactly what happened. So at that point, the orthopedic had to step in.
And did they have to do an MRI or any other kind of testing on them?
Yes, and that's usually initial protocol just to make sure we have the best possible diagnostic imaging to assess these injuries that normally wouldn't show up on an X-ray. In this case, the orthopedic ordered the MRI, and we were able to fully assess the severity and scope of AO's injuries.
After the MRI, what kind of treatment did AO have to have then?
So after the MRI, initially they try medication, but quickly they pivot to injections. Injections act as a further diagnostic tool because the MRI will give the specialist a pretty good guess or indication of where the pain's coming from and what the injury is. But the injections themselves really take it home and remove all doubt. So if they suspect a certain area of the spine is the culprit for the pain, they'll try and inject that area. And if the pain goes away, then they've said, the ortho gets to say to themselves, well, that was definitely the culprit. In this case, it did help, but the pain didn't go away after multiple injections. So that took AO to the next level of potential surgery.
Did AO have to have the surgery, or was it recommended so he's likely to have it in the future? What's going on there?
AO did, in this case, have to have the surgery, a specific type of spine surgery that helps once injections do not relieve any further pain, because you're, as an injured victim in a motor vehicle accident, presented with a hard choice sometimes when the injections don't work, which is, do I want to get fully better, or do I want to move on and be stuck in chronic pain for the rest of my days?
And that's always my concern whenever anybody wants to make that choice, is just the idea of 10, 15 years of pain getting worse. Seems like a terrible outlook, I guess is what I'll say. Not much of anything to look forward to. And I think once you sort of settle into that role, it's pretty easy to just get in a pit kind of deal, or depression, or start using pain pills or something like that. So we're always happy when they can get better. Did AO, after the surgery, how did he feel?
So the surgery addressed some of the pain, but there was still pain even after the surgery. So that's why this case was so serious, because serious injuries and basically modern medicine took AO as far as possible, but not every case sees full 100% pain relief. So that's when we as attorneys, it's our job to step in to explain that to the carrier and be like, look, we did everything these specialists told us to do. And we weren't able to relieve all pain. So the case needs to be compensated that way. And in this case, it definitely got the insurance carrier's attention.
And were we able to successfully resolve the case, and was AO happy?
We were able to successfully resolve the case and find all available insurance coverage.
Okay.
In this case, that means, a 6-figure settlement for AO.
What AO say when you talk to them about the settlement?
Obviously, we were going for the full amount available, so AO was happy that we were able to achieve all the known monies on the case.
Well, that's good. I mean, and when you say all the known monies, that means basically all the money the insurance was contracted to offer. We were able to get that for our client and bring it into the settlement for them.
That is correct.
Well, it sounds like as good a result as you can get and a great result for AO. And a 6-figure settlement is always good, obviously, and a significant amount of medical care to get better as well. Thanks a lot, John, and thanks for all your hard work. And it sounds like AO was lucky to have you as his lawyer.
Thank you, Shane.
For all our listeners out there, if you'll hit like and subscribe so you find more client victories from Shane Smith Law, or hit that little bell so you get notifications when a new story is up. And always remember, Charlotte, if you're in pain, call Shane, 980-999-9999.
In pain, so I call Shane, 980-999-9999. In pain, call Shane.